Good morning. Good morning, everyone.
Good morning.
That's what we like to hear, a little energy. My name is Bob Hughes. I'm President and CEO of the Missouri Foundation for Health. And the foundation is pleased to be co-sponsoring this event along with the Healthcare Foundation of Greater Kansas City and the Midwest Health Initiative. And on behalf of all three of us, welcome. Thank you for being here this morning. You all are an impressive group. You come from a number of different sectors, and you have a wealth of experience in each of those sectors. And that's the perfect prescription for lively and engaging and stimulating conversations throughout the morning. So this should be a great day. One of my tasks as the first introducer is to remind everyone, please, to silence your cell phones and any other devices that make noise. Thank you for that. This Health Data Summit is especially timely. We're in the middle of incredible revolution in information technology and the availability of large amounts of data that can be mined for a variety of purposes to really extract value. And at the same time, our healthcare system is in the midst of unprecedented changes. We're also seeing a resurgence in our interest in wellness and thinking about health as a much broader concept than simply medical care. And all of these factors come together to really provide a great environment for innovators and entrepreneurs of all stripes, and that's why we're here this morning. In Missouri, we're hopeful that this healthcare summit will help us start a conversation that will continue on beyond today to help us take advantage of the data that are available and harness those data through new tools to really make some progress on many of the serious health problems we have. Now it's my pleasure to introduce our newly announced Health and Human Services Acting Director for Region 7, Jay Angoff. Director Angoff serves both as our regional director and as a senior advisor to Secretary Sebelius. Those of you from Missouri may recognize his name from his previous stint as Missouri Insurance Commissioner, and we're so pleased to have him back in the four-state region and in the Midwest. Please join me in welcoming Jay Angoff.
Thank you, Bob. Thank you for your kind words. We're very lucky to have you here. I remember your work with the Robert Wood Johnson Foundation on substance abuse in general and tobacco in particular. Those are very relevant issues here. Your expertise that you've gained there will certainly be very, very welcome and needed in Missouri. I'm very pleased to be here. Todd, who you'll hear a lot about and hear a lot from later on, loves to talk about how the government is going to liberate data. And that's what we're here to do. The government has all this data, has tremendous amounts of data, and we use it, but we want everyone else to use it, and we want entrepreneurs to use it. And we just think that by liberating this data and making it available to businesses and researchers and developers, that we can help both reduce the cost of health care and improve the quality of health care. I'd like to thank the Missouri Foundation for Health and the Healthcare Foundation of Greater Kansas City for sponsoring this event. Both of these foundations have done tremendous work. They're both conversion foundations. They were formed as a result of traditionally nonprofit organizations becoming for-profit, and they're a terrific example of what can benefit the community when these for-profit organizations, when nonprofit organizations convert to for-profit status. They've been terrific in educating the public about the healthcare system, in doing healthcare advocacy, in serving the needs of the underinsured and uninsured and underserved. So I'd really like to thank them. And also I'd like to thank the Midwest Health Initiative, and particularly the group that has spearheaded that, the St. Louis Business Health Coalition, which for years has been a force, a progressive voice for purchases of health care. And what they've done on both cost and quality has benefited not just businesses, but all of us who purchase health care. And finally, I'd like to say a couple of words about three people. Number one, you'll hear a lot more about him and a lot more from him, but let me just say two things about Todd Park, whose vision is really responsible for the Health Data Initiative. Two things you got to know about Todd is, number one, he can make the most boring technical things sound exciting, particularly to those of us like me who don't know much about technology. And second, he is the most cheerful man alive. So if you happen to be in a bad mood this morning, if you got up on the wrong side of the bed, Todd will put you in a good mood. Second, I'd like to introduce the person who's really responsible for bringing the health care initiative to Missouri. She served 8 years in the Missouri legislature, gained a well-deserved reputation as the legislature's expert on health care. She had a very successful career in the private sector, in the health care business. She had to leave the HHS because she is now running for public office. Please, Judy Baker, stand up and be recognized. And finally, you know, the Department of Health and Human Services is a very large organization, and it is very difficult to run this organization. I'd like to now introduce the person who probably more than anyone else is responsible for running the organization. He and his staff, as he likes to say, make the trains run on time at HHS, but he does more than that. He denies it, but he's also a real expert on both health insurance and health care. He bought health care for three of the largest corporations in the country. And he's also a very good lawyer. He was the managing partner at one of Kansas City's most respected law firms. Please welcome Ned Holland.
He just stole the secretary's line. She says, Holland, everybody else gets to think big thoughts. Your job is to keep the trains running on time. I got it. I used to call her governor. I now have to call her secretary. I am Ned Holland, and I'm happy to be here this morning. Thanks again to our sponsors. You're going to hear from sort of a duo of us who spend a lot of time together. In a minute, we'll introduce Todd just a bit, but Todd and I work very closely together on a whole range of things in order to sort of see what are the names and numbers of the players. Todd is our Chief Technology Officer. His job is to envision the future and to encourage the use, and he'll talk about data liberation a bit, and I'm going to leave that to him. My job is to run things, and the CIO of the department and the department's information technology operation reports to me. We spend $6.5 billion a year on information technology at the Department of Health and Human Services. It's a big doggone deal and a lot to be harnessed, and that's what Todd and I work to try to do. I assure you that Todd is the smart guy in this crowd. I'm just sort of the train conductor, and I help him get the stuff done that he needs to get done. It is a pleasure to be here with you this morning, and I want to bring you the Secretary's good wishes. She's very interested in the work we're doing here, the work you're doing in Missouri. As you well know, she was the governor of Kansas. Second to Kansas, she has great relations to Missouri and Ohio, where she comes from, and she sends her regards. She'd love to be here. She just can't be everywhere, and she seems like in some weeks that she is everywhere. She's interested in the ideas that you'll bring today, and we will take them back to her. As Jay indicated, I'm from around here. It's good to be back home in Missouri, if not quite yet back home in Kansas City, although I'm going there tonight. And I have a great fondness for St. Louis. During the part of my career, I was here about, 3 times a month for years, several years in a row, and I spent a lot of time, mostly downtown, not out here in the county, but the heartland is well represented, and I'm happy to be here. It comes as no surprise to me that Health Data Initiative events would come to St. Louis and to Missouri. The business and the academic communities here, as I know them, have always promoted a pioneering spirit and encouraged new ideas and have created opportunities for business models in a variety of ways. Today, you're going to meet some of those innovators. Todd and I are listening to them with great interest, and we'll take their ideas back, and we want you to gather their ideas as well. You're going to hear what's around the corner for the healthcare system. We are in an unprecedented period of transformation in healthcare. I've worked in the healthcare industry for 40 years, one way or another, and I've been on, frankly, all sides of it. And we have never been in a period when it was going to change more. Our goal at the Department of Health and Human Services are to improve access to the right services and products, improve the outcomes of healthcare, and improve the efficiency and the performance of the system. Regardless of whether you're a consumer, an employer, a payer, a provider, an administrator, community health services advisor, there's a common need for better data. I've been after data for many years. I'll tell stories perhaps later about that. But one of the hallmarks of an emerging marketplace is the development of measures that give us a sense of direction and enable us to focus on improvement and, importantly, data opportunities for innovation. Missouri is the show-me state, and that approach supports and rewards the spirit that we're after quite well. The need for data and information services cuts across all of our segments of our community and the economy. I can't think of any better way, any better vehicle to bring together the providers, the health system professionals, and the employers, the folks who buy that health care from them. Prosperity lies ahead, we believe, and we've seen it already, for those who find ways to provide new means to manage risk, to utilize each other's strengths and weaknesses, and they are all out there, and cultivate a spirit of innovation. Prosperity lies ahead for the people who can figure out how to do that. Today, you're going to hear from leaders of a variety of industries and a variety of places who exemplify this ongoing quest to improve the health of the people, not only here, but nationwide, and frankly, in some respects, worldwide. I'm personally struck by the passion. I've talked to some of them as we were getting ready. I'm struck by the passion with which they're pursuing the answers. They're willing to test new ideas, find new approaches, discover better insights into healthcare. In my work over the years here in the Midwest, I know the close connection that exists among the people and the parts of our community. People often think of our region as a high work ethic region. True enough, I believe that to be true, and I continue to tell people that as I travel the country. But I remain impressed, in addition, by the connectedness among our institutions. You look at our three sponsors, and they represent that connectedness. There are people in each of those organizations who represent a variety of parts of the healthcare system, and they should be commended for bringing those folks together, and we're happy to have them here today. I can't help but think that connectedness is the strategy for success in the information age, and if you haven't figured out, we're in the information age, no doubt about it. The great university and business forums that bring us together are well represented today. Chances are someone here will make a connection that will lead to an innovation, that will produce an entrepreneur, that will generate revenues, that will produce an outcome that will better health care for the people of this country. I believe that the work you're doing here today, and we are doing here today, is incredibly important for the future of healthcare and of our country. The stakes are very high. We cannot afford to fail to invent our way out of the unsustainable healthcare system in which we function today. We cannot afford to fail. The system is unsustainable. Our hope is that the day inspires entrepreneurship and creativity and competitiveness that brings forth for the next generation an affordable, high-quality healthcare experience each time, every time, for every person. That's what we're up to. A legend from around here said, high expectations are the key to everything. Sam Walton changed the consumer experience for the United States of America and for the world. maybe we can take his high expectations being everything as a hallmark of what we're up to today. On behalf of Secretary Sebelius, I want to thank you for the hard work and the devotion you give to this industry, this mission, which really is the health care of our people.